So what's happened is that the osteoarthritis has worn down my tibia and fibia. The left leg is worn more dramatically than the right, but the right is not far behind. And about a year and a half ago, I had surgery for torn meniscus on my left knee. And when he got in, the orthopedic surgeon said it's not from an accident. He said your cartilage is flaked like crab meat. And so there's a lot of just floating loose cartilage. And the pictures that he took shows a lot of inflammation in the cartilage, which is not good. So we did x-rays last week, and he saw significant deterioration in the bones from the last x-rays he did, which, by the way, have really ugly veins. And I'm doing this in front of a group of people if this weren't my baby girl. Nobody gets to see my legs.
Actually, I think you have nice legs.
Sometimes it's in my shoulders, my elbows, my ankles, my feet. It just travels, and I have no idea how to predict where it's going to hurt.
Okay, well, here's what I'd like you to do. Would you just mind just walk up and down that section and come back, just so we can have a baseline of what you feel like right now?
Okay. She's got, osteoarthritis. The muscles around there are so fried from trying to support structure that has been worn down over time. That I could totally see why green would be awesome.
Remember green for joints. I was mentioning green for joints. Well, this is certainly showing itself. So what I'm going to do is I'm going to do like a few different steps of treatment after each one. I know this is a lot of work. I just want to see if you'll walk after each one so I know which one's actually helping you the most.
Okay.
That's the proof is in the pudding, is what they say. So this is the circling the dragon treatment. Do a very low electrical conductivity in this knee area. Are we getting anything coming through? It's nice and wet.
We would frequently get zeros right in those.
We got to charge you up. These are called the eyes of the knee. And these are often needled with acupuncture needles right here. He's asking you to breathe deeply into your lower belly. I mean, that will actually make this treatment work better. Just lift here. The back of the knee is the point, weight shown or bladder 40. So we're running it right through the knee like this. This is pure circling the dragon, local treatment. I'm going to do the same thing on this knee now. What I'd like is just do that little walk and see if it's the same, better, or worse in every case from that first technique.
I think it feels better.
So let's say what percentage of improvement, if you were going to guess, let's say from when you came in this room until now, did you get from that first technique? But just rough estimate.
That's always hard. I would say about a 35%, maybe 40, somewhere in there.
That's very typical of what I get from circling the dragon. Usually there's almost always an improvement. It's anywhere from none sometimes, but usually 30% up to 60% just from circling the dragon. But even if you get a lot of relief from circling the dragon, it may not last as long as if you do the other ones with it. So what I'm going to do is now change to probe preset number 2, dermatome and distal. And so I'm going to do a positive there and negative on the knee. So that's the first option 1 polarized treatment. Same quadrant. Remember I was talking about yesterday. So.
Sorry. Thank you.
Keep breathing deeply, please. That was a good one.
And I didn't do it. It seems to be in pain.
And I'll do a gallbladder 34, which is the,
It's
you
okay,
still have a gallbladder meridian though, thankfully.
Yeah, it's like the train station is removed, but the railroad is still there.
That's right, there you go. Okay, please take another walk and let's see if it's the same, better, or worse than what you had just a few minutes ago.
I feel stronger in that
Okay.
area.
Good.
Strengthened. The back of my right knee is still very vulnerable.
Okay.
And weak feeling. But
Okay.
My muscles feel stronger.
Stronger, okay. So the polarized treatment had that effect. Okay. 8-5 when I go.
I think we're okay. No?
Take some deep breaths again,
I
please.
don't know what's going on.
Okay, it's up at around 40. It's a pretty good change. You're not tender just because it really helped. Hold. Ooh. Rock solid on
What
the
color
agenda.
is it?
Okay, so now what I'm going to do is treat from your belly to your back to strengthen your kidneys, because that's going to help your knee. Why don't you just hold this right there next to your belly button, and I'm going to go over to your back and treat the bladder 23. And take some deep breaths again, please. This is Mushu technique. Positive on the front, which kidney 16 is a good move point for the Japanese move point for the kidneys. Okay, that's all you need. Doesn't take a long time to do that. Why don't you take that little walk again, see if it's the same, better, or worse, please.
You're using preset 2?
Preset 2, yes.
It's better. Yeah, it's better.
You're walking a lot faster.
Yeah.
Okay. Yeah. Speak.
It is better, even the back where the meniscus is feeling better.
Good.
Yeah.
So how much better? Okay.
I would say from last time we were at 30, I'd say we're 65.
Percent better?
Yeah, yeah.
Yay, all
So-
right. So this is obviously a very challenging case. I mean, she actually has torn up cartilage. I mean, this is not, an easy case, but really, if I wasn't talking and narrating, that was about a total of 5 minutes of work that I just did, maybe 5 to 7 minutes of work. So it shows you how quickly this stuff can help. And it's also the importance of muscle testing, because getting the right color makes a big difference. Other follow-up could be putting interferential pads around her knee and having her do some exercise, but that's because with all that degeneration, you have to do that just a little bit. You wouldn't want to do tons of that.
And I would have her do nothing with resistance.
Yeah.
I would just have her do gentle, like just through a very small range of motion at the knee, just a little flexion and a little extension with the interferential pads on. And deep blue, we use deep blue a lot.
We want.
Yeah.
Just on the microphone, just give me a final comment, please, Billy.
Well, it just feels so much better. My muscles feel stronger, and the pain is significantly reduced. Yeah, it's
That's a
great.
happy thing.
It is a very happy thing. Yes, thank you.
Okay. Well, this is true multimodal microcurrent you're seeing here.